Not allow you to go into that. Let's transition and talk about the manifesto of Kenya Kwanza.
Why I called you 3 times is because I told you that conversation, now we move to the right conversation.
And the Kenya Kwanza manifesto,
yes, you have taken us to politics,
which some of you supported.
Yes.
On the health question, there was a promise to make sure that you improve the contributions to NHIF. So that time the promise was about NHIF, and the research had shown that you needed each of the 12 million households to contribute 12,000 shillings, and you're hoping to raise 200 billion shillings required to cover both the secondary and tertiary pillars. Works out an average of 4,000 shillings per person or 16,000 shillings per household. So eventually the promise was that contributions ranging from 300 shillings to 3,000 shillings per household per month, that was annually, was supposed to be 3,600 to 36,000 shillings per year.
Or just about.
Yes. Now, you came into office and the proposal is 2.75% without a cap. And this is what Cabinet Secretary Nakhumicha Wafula hopes to implement as soon as is possible. What was lost in translating the manifesto to the law now that you've lifted the lead? Because here it appeared the maximum would have been 3,000 per person.
I think the catchment area may have been slightly smaller. So we look at your income so that you now pay proportionately to what you earn, which again I agree with, that there is no point of me earning so much and yet I pay so little for healthcare, because we've got a whole population that is unemployed. Maybe many of them do not have stable income, and here I am earning the kind of money that I earn, and I am not able to contribute something proportionate to it so that we cover as more households as we can.
So Chairman, what do you do with this? Because as a question of accountability, the promise to the people was between 300 shillings and 3,000 shillings. That was the promise. Maybe that's why someone voted for you. You come into office and you say, do away with this cap of 3,000 shillings, open it up because now new reality has come. How do you explain the difference?
The difference is when you look at the mathematics, it may not be sufficient to cover the households.
You didn't have a view of that during the manifesto?
Possibly we thought we would have a bigger base, which we now seem not to have.
So
the 300 remains.
You speak of the 12 million households. There are still 12 million or around that.
Or around that, yes. But
so what has changed?
Possibly the money is not sufficient because everything has gone up. It's expensive to offer a reasonable medical care to the people. And this is why we say, look, open it up. Let's have those who have pay for those who do not have.
Do we now know what the 2.75% is supposed to raise?
Depending on how much you earn and...
no, the total.
I'm not so sure what the total is. That I would have to find out from the Minister of Health.
And Senator Mutinda, don't you think that's the problem? Because things were very clear at the manifesto drafting. When it comes to implementation, the rollout, there's a percentage that is not capped, but it's not clear how much is supposed to be raised. What's happening?
What is happening is that we have a president who is, apart from being a politician, is also a very good manager. And a manager in the sense that, yes, you promise, but you are open to good managerial skills, that when you get the facts and the reality within that particular docket, as a leader and as a good manager, you readjust, you relook into the issues so that you can be able to achieve the goal. And there's nothing wrong in readjusting. It might be a bit costly, but the bigger goal is to ensure that we have a health, we say a healthy nation, a wealthy nation for our people, because still the Constitution requires that we offer good health systems to our people. So was the 300 to be enough? Was it going to give us a much more bigger achievable strategy? It would not. And so there's nothing wrong. They say that it's a fool who does not change, who does not make a change. So there's nothing wrong in the changes that are in place. Remember, the chief is also coming with a fund that is going to ensure that it focuses on machineries, medical equipments, and also maintenance of the same medical equipment. Unlike the initial NHIF system that was you and me, we get the medical service.
And all those things you're describing are actually captured in the manifesto. Okay, maybe using different terms, but it's, the general idea is captured. You're saying that facts and reality has come, and things are clearer now. Yes?
Yes.
So how much will you raise from Chief?
I don't have the mathematical figures, but...
So what facts are we dealing with then?
I'm talking about what
Policy.
the policies and what is not in place. For example, the equipment. The issue that has made our medical to be more expensive is the lack of the adequate equipment within our hospital institutions. That is why people have traveled abroad to be able to get services and like...
That is clear. It is not in dispute, Senator Mutinda. The specific question I'm asking, the manifesto was hoping to collect 200 billion shillings, and this was to be achieved through 300 to 3,000 shillings per month contribution per household. And it was working, and Kenyans voted for it by majority.
Let's be frank, that's the theory, the theoretical bit. That's the theoretical bit. Maybe now we do not have the numbers we hoped would contribute to 300.
Where have they gone?
Because, you know, there has to be mechanism of also collect. It's voluntary. It's not a tax.
Well, the law you passed in Parliament was mandatory.
Right.
Never mind that the High Court has said that that is suspended.
That is number one. Number two, once the base is not as large as we thought it would be, it was more prudent to open it up so that you are able to collect more money and attain that particular target. It is easy always, of course. The government collects money through taxation. And
so, Shifi, is it taxation?
That's also taxation because, I mean, it's mandatory. You have to pay. And if it is, then you pay the tax for the benefit of the entire country, not yourself alone.
Again, do you have a formula of how to reach the non-salaried Kenyans?
Again, that has to be worked on because, remember, we call it informal. So you have to find a way of formally reaching the informal people out there who have to pay to you 300 shillings.
You know, Sam, I'm sorry to say this.
Yeah.
I think, honestly, because I'll have to go because I'll cut to matter shortly. You know, listening to Mheshimiwa and Senator here, they speak as if the people in this government today are new in government. And that's one of the biggest lies. I mean, I'm sorry, you don't want me to use the word lie, but at least it's one of the biggest political lies we've lived in this country. And I'll repeat it again here, and I've said it in a show before. Dr. William Samoei Ruto is not a newcomer in government. He's probably one of the longest elected politician in the history of Kenya. From 1997, he's never lost an office. So mean, and he has held very senior positions in government. Musalia Mudavadi, on the other hand, Tangula, all those people top notch of UDA are not new in government. So when they come here and they are not able to explain things clearly, that they say, oh, we don't have these, we'll this. So what have they been doing in the public service all these many years? And I think this is the fundamental question Kenyans now need to ask. And that's why I keep on saying, these are people, I think, who came into government either to commercialize politics, but not really to offer solutions. Because if you've been a minister, senior minister, Chair, let me explain. I think that's the fundamental question we need to address. You don't give people promises and then you start coming to say, oh, you know, now the situation has changed, you know, only fools don't change their mind. Then it means, I mean, why did you promise what you promised when actually you've been in similar situations as government for the longest time? That is one of the biggest lies we are dealing with in this country. People going into politics for personal aggrandizement and enrichment, but not really offering solutions to the people. And I'll still go back to the point earlier I made, that if you really had your people in mind of your constituency, you will rethink the Finance Act as the way you guys passed it. You will rethink the NHIF. You will not be coming with the changing terminologies. Can you imagine during the NSSF, I mean, during COVID outbreak, we could not even use the NHIF card in hospitals. And these are same people who were in government at that time. Of course, they are called Jubilee at that time. Now they have changed name to UDA. You know, I'm sorry to use this metaphor. Yeah, a monkey will still be a monkey even if we change forests. Even if today we dress a monkey in a suit and put it to take it to CBD or to Kilimani or whatever Westlands, he will still be a monkey. So,
but let me ask you one question. He has criticized.
I'm giving you constructive criticism.
You have not offered even one out of.
I'm giving you constructive criticism.
Look, you're not saying implement the 300 to 3,000, do this and this to help in this. You're just saying, sorry, this is a lie, this is a lie.
Correct.
The question is this: is the government making an effort to offer housing in accordance with Article 43 of the Constitution? The formula may be a little bit not clear.
Not maybe a little bit. Just say the formula is not there.
No, the formula is there because we have a law in place. We are not mad to have passed this law. Sincerely speaking, we have made an effort so that we comply with the Constitution. The Constitution talks about health care.
But you are punishing your own supporters. That's what I'm saying to you.
But the government has no farms. The government has no nothing. The government has only taxes and borrowing. We have overborrowed, so we have a problem. So we really have.
So can I give you a solution?
So we have really to work slightly more.
Can I give you a solution, Mheshimiwa?
And we are not doing badly, by the way. Our taxes are not as high as some of the countries in the world. So slowly by slowly, as Kibaki put it, we just have to pay taxes.
Sorry, what does it mean to say that taxes are not as high as other countries?
Is some countries, some levels of taxation.
Give us comparisons.
In some countries, including the European countries and the Scandinavian countries, they are much higher than ours.
So tell me, let's be specific, because an employee today, whether in private or public service, you pay a maximum of 35% on your income now.
There are some countries that pay up to 50, 60%.
I'm getting somewhere.
Good.
You have 2.75% on shift coming, 6% on NSSF already in force. Then you have 1.5% coming or returning on housing levy. If you do the math, this is close to 45%.
That is on a very high income person.
Exactly.
Yeah.
So that's not high?
It is high to some extent, but I can assure you in other countries, it goes to 60, 65%.
Sam, let me help Mheshimiwa. Let me help Chairman.
And I will give you Austria as one of them.
No, Chairman.
Yeah.
Let me help you.
The quality of services in those countries that you
The quality of services is extremely high because they're developed. We are now beginning to take off also to become developed, so that with that high taxation we are talking about, we should see the differences slowly as we move towards development.
Sam, let me help Chair here. I'll give Chair an example.
Let me say something.
804.
Yes,
and I needed to hear from Honorable Lachi and Senators so that we...
But I just want to use one simple example.
There's a show that is coming up. We need to conclude on it. Honorable Lachi, your take on the housing promise versus what is being attained?
On the NHIF.
Sorry, health, not housing, health.
Now,
promise.
first of all, for me, where I want us to really look at is if there is any Kenyan who paid his NHIF fully for 1 year, we need to be telling this Kenyan what will happen to his money. Are we transferring the money to SHIF?
Possibly, yeah.
And in what?
Or are we refunding?
Because right now, all of them have NHIF, and they're just there, wondering. And yet there's billions of shillings that is just hanging there. Then is there a way the technical team, not now Parliament or anything, Sam, this should come from the technical team who are advising on how we are shifting. How much is it that is shifting from NHIF to go?
Yes.
And is it possible first we clear bills, this pending bill of 29 billion, so that you move clean? Because you are saying now you are moving to a new. That should be one of the things. The other thing I would want to really request is that, you see, why we are having all these challenges, and this I want to just say in a very humble way to government. When we started moving to the 21st century, and Kibaki brought in the Vision 2030, it meant every government that comes
continues that.
You look at the vision, you have your manifesto, yes, but you're enhancing on the vision and achieving the Vision 2030.
You align it.
And you realign yourself on the vision, so that by the time we come to 2030, we are able to say, this was the blueprint for Kenya, this is what we've achieved, just the way the Millennium Goals have moved to SDGs and all that.
Right.
But now, if we move like this, and I want the government to go back and look at this thing of everything, you have a fund, you have a fund. Be very cautious about these things called fund. I'm saying this because we are all Kenyans. We understand ourselves that we know how to dip so much in a jar. The president might have a very good intention, but trust me, as who are implementers, you know the president is not the implementer. The implementer is us who are now given.
Honorable Achi,
yes.
We need to wind up. And you speak about funds, new funds. This morning we're learning that the Education Ministry is speaking about cutting the capitation to 17,000 from 22,000. We already have the university funding model where parents have to chip in for something. The health sector has SHIF, the housing has the affordable housing, and so much more. Senator Mutinda, so when you reflect on the manifesto versus what is being attained, what shall you tell the people?
That as much as the government is not new, or the people and the leaders are not new, but the manifesto is new. And it being new, yes, I agree, it has to align to the strategies of the 2030 vision, and there's nothing wrong with that. And the leaders have been elected by the people. Does it mean that the people do not know their leaders when they are electing them? That is not the case. They have confidence in their leaders. And I repeat and I say that what we need to see coming from the opposition who do the check and balance is what strategies and proposals and solutions they can be able to add to this government so that they add a plus. Because one common denominator, Sam, is that we are all Kenyans, we'll always be Kenyans.
Right.
So we cannot run away from realities. And the manifesto is not cast on a stone that things cannot be able to adjust or not be able to change.
Okay.
But some
I have a suggestion.
I don't hear anything more.
No, wait.
No,
I must rectify. We must go knowing this.
Opportunity
we like
8 minutes past 8 a.m. and that's our time here on Daybreak. Senator Tabitha Mutinda says, Senator Mutinda says that the manifesto is not cast in stone. There could be adjustments. The conversation continues some other time. Up next is Matter Social with Safina Che. My name is Sam Gituku. See you again. You have a court matter.